Hi, I'm Dr. David Nonweiler, an orthopedic surgeon in Tulsa, Oklahoma. I'd like to talk to you about a new and exciting technology in orthopedic surgery. As of June 2017, we have a new surgeon-controlled, robotic-assisted total knee replacement system available. So, why is this system so great? In knee replacement surgery, alignment and ligament balance are crucial for good patient results. So, when we talk about alignment, a line from the center of the hip to the center of the ankle should also pass through the center of the knee. If this alignment is off, or if the joint is unstable, one area will wear more quickly and the joint replacement will fail. This new system is cutting-edge technology which allows us to objectively and accurately measure joint alignment and stability. The process starts with a CT scan. From this, a computer model is created and we plan the position of the components of the total joint. Once in surgery, we adjust the position of the total knee to ensure the knee is aligned and stable. Then, the robotic arm, which is controlled by the surgeon, makes precise cuts per the computer plan. The total joint is then placed. The system allows us to consistently place a total knee which is well aligned and stable. This is the X-ray of the final product. So, if you have failed all non-operative treatments and are considering a total knee replacement, I would recommend the use of this new cutting-edge technology. This technology helps me consistently obtain the best alignment and ligament balance possible. This helps ensure the best possible outcome for my patients.